A medical education to the foundation programs. The foundation program is a 2 year program which forms the bridge between the university level start as a medical school and specialist of general practice trainer in conscience of series of placements is lasting 4 months, which allowed the junior doctor now as a training to samples different specialty. For example, pediatry as a year one trainer FG1 correspond to registration house offers PRHO past years to training FG2 to senior house offer post age training has an education supervisor who's ensured that smart senior doctor deliver training in different years in different way, including clinical and educational supervision to progress training has to demonstrate a range of clinical competence, with arts as sex draws as sex as six draws as observation in their workplace. People in medical education, tutor, tutor as an academy, or in some case a postgraduate student who left tutorial demonstrator is an anatomy teacher, someone who demonstrates how to disease. Demonstrator are often graduates, postgraduate students paying their way through medical school, later senior letter. An academy was teaching and research responsible who contribute to the teaching on a particular discipline. A senior academy was teaching and received responsibility for a particular discipline using a learned figures in the disciplines. College tutor, a consul responsible for delivery, and a college training program, clinician training, a consul assigner to a trainee who provides training during periods of direct clinic care, educational superior, a consul who supervises a training period of training, medical qualification, Bachelor of Medical Science, a degree of intake after 3 years of medical study by a student who may wish to follow a career in a medical research. Bachelor of Medicine, Bachelor of Surgery. Bachelor degree are undergraduate degrees. This is the first degrees for UK doctors. Doctor of Medicine, Diploma of the Royal College of Obstetrics and Gynecologists, member of the Royal College of the Physician, or member of the Royal College of the Surgeon. Doctor become members by successfully completely completing complete the assessments procedures in the college. Fellow of the Royal College of Surgery of England. Other colleges are indicated by the letters which follow. For example, Edinburgh, Glasgow, or Ireland. House doctor become a fellow depend on the college for the FRCC. Further examination must be passed. For other college is a by nomination of work assignment. This is of the siglas of the medical qualification. In the first, I can watch BMSC, BM. ADCSE is Bachelor of Medical Science, and the second part is the siglas is this means of Bachelor of Medicine or Bachelor of Surgery. The third sigla is Doctor of Medicine. The next is Diploma of the Royal College of Obstetrics and Gynecology. The next sigla is Member of the Royal College of Physicians or Member of the Royal, and that's it. And the last unit is the Overseas Doctors. Tie of register. To managers and trained patients in the UK of doctors must register with the General Medical Council. There are several types of registration. Provisional registration is for doctors who have just qualified from medical school in the UK and from certain Europe economic are EEA member states. Full register is for doctor who has completed a year's clinician training. Limited register is for international medical graduates who has not completed the equivalent of a year clinical training in the UK. Especially registration is for doctor who has completed specialty medical training and have a certain certificate of training or CCT. The GP register is a register of all those elements to work in a general practice in the NAS. Plan B. Before they can obtain full register, some category of overseeing doctors are required to take the professional language assessment board Plan B test. Plan B is designed to ensure those who pass can practice safely at the level and say age of is a free appointment in a UK hospital. Part 1 consists of a right test of knowledge, skill, and attitude. Part 2 is an objective structured clinical examination. It consists of 16 5 minutes clinical scenario. Snow as a station to ask professional skill. Plan B station of advanced clinical examination. Your ability to carry out physical examination and simulate patient as an actor training to play this role will be a same uncomfortable or intimate examination will be carried out using a manicky anatomical models. Practical skills, you would be a sense of practical skill, so as a tutorial of giving intravenous injection. Communication skill, use ability to interact with a simulated patient, or in some case, the examiner would be assistants. Skill rates may include breaking back new and giving advanced lifestyle and history taking. Your ability to take accurate history, make a reasonable diagnosis will be the same. Advance observation from a successful candidate. Read the instruction outside each station carefully. You have 1 minute for this. Don't forget the AMBC airway breathing circulation protocol is every emergency station. Keep in mind safe precaution like throwing the shark with the shark beam. Check the patient, understand what is the happening then as they about any concern. They may have to you give a lecture. Listen carefully you what the actor says. El médico extranjero. El médico extranjero, tipo de registro. Para poder atender y tratar pacientes en el Reino Unido, todos los médicos deben registrarse en el General Medical QC o GMS. Existen varios tipos de registros, que estos son registros provisionales. Estos son para médicos recién graduados de facultades de medicina en el Reino Unido o en ciertos estados miembros del Espacio Económico Europeo, que es conocido como la EEA. También existen los registros Full Registration para médicos que han finalizado su formación clínica de un año. Y existen también los registros registros ilimitados, que son para graduados internacionales que no han completado el equivalente a un año de formación clínica en el Reino Unido. Limit Registration and Specialty Registration, que son registros de especialización, que son para médicos que han completado una formación especializada y han obtenido un certificado de finalización de formación o CCT. El registro médico general GP Regist es un registro de todos los médicos elegibles para trabajar en la práctica general dentro de NHS. Plan B. Antes de obtener el registro completo, algunos médicos extranjeros deben realizar el Professional and Language Assessment Boards. Plan B. Este examen garantiza que quien lo aprueba puede ejercer de manera segura al nivel de un SHO en su primera posición en un hospital de Reino Unido. Parte 1, que esta consiste en un examen escrito sobre conocimientos, habilidades y actitudes. Parte 2 es una evaluación clínica estructurada, objetiva OSCE, con 16 escenarios clínicos de 5 minutos cada uno, diseñados para evaluar habilidades profesionales. Plan B, Professional Language Assessment Boards, que es el plan B, es necesario para que algunos médicos extranjeros tengan el registro completo en el Reino Unido, y esto se divide en dos partes. Parte 1, parte 2, que es la parte 1, un examen escrito que evalúa conocimientos, habilidades y actitudes. Parte 2, un OSCE Evaluation Clinical Structural Objective Structure Clinical Examination. Evaluación clínica estructurada objetiva con 16 escenarios clínicos de 5 minutos cada uno, enfocados en evaluar la habilidad profesional. Y por último, el plan B, consejo para el OSC. Estos tienen exámenes clínicos, realizan un examen físico en un paciente simulado, también habilidades prácticas, evaluación de destreza, como la administración de inyecciones intravenosas, habilidades de comunicación, interacción con pacientes, simulados, incluyendo la entrega de malas noticias, toma de historia clínica. También existe que estos son la obtención de información precisa para llegar a un diagnóstico fundamental. Consejos de un candidato exitoso: leer con atención instrucciones fuera de cada estación, recordar los protocolos A, B y C, vías aéreas, respiratoria y circulación. También considerar precauciones de seguridad como el descarte adecuado de objetos pulsante en el contenedor de residuos especiales, verificar la comprensión del paciente y abordar sus inquietudes. Bye.